Hello, my name is Sherry Cook. I am a health educator from the University of Florida. I'm here today to talk to you about sexuality and contraception after the birth of your baby. The information I will be discussing today is general information. Your personal needs or experiences may be different. If you have special circumstances or private questions, I will be available after class to speak with you. Throughout the program, I will be open to questions. Do not feel like you need to wait until the end of class. If I do not know the answer off the top of my head, then I will be happy to either look it up for you after class or refer you to someone who can help you. If there is anyone here who speaks English as a second language, see me after class and I will help you find resources in your preferred language. I have tried to make this class as inclusive and supportive as possible. I would ask that you have respect for everyone here in any of your comments. I would also ask that you respect each other's privacy. Thank you, and let's get started. Congratulations on the birth of your child. It is an exciting and sometimes overwhelming time in your life. Many things will change now that baby is here. Your life will never go back to your old idea of what's normal. You will learn to create a new normal in your life. Sexuality is one of those things that will change. Some people are uncomfortable talking about sex openly. That's okay. I would like to encourage you to discuss any topic here related to today's lecture. Your sexuality is a normal, healthy part of your personal life and your relationship. It's okay to talk about it openly and honestly. I would like to start by making a list of some of the questions and concerns you may already have. We will be covering the following topics today: postnatal abstinence, postpartum changes for women, self-care for women, breastfeeding and sexuality, dads and partners, practical tips for sexuality and intimacy, and contraception. If we need to talk about one of these things more or something that's not listed, we can be flexible. It's a simple fact that a woman's body is different following childbirth. Let's briefly talk about some of these changes. Lochia is a medical name for the normal bloody discharge following birth. It usually lasts from 4 to 6 weeks. Once this discharge stops, it is a sign that your cervix has healed and closed. It's also usually a sign that you can participate in sexual intercourse again. If you had an episiotomy or any tearing, you will most likely have stitches. Remember to follow any instructions you are given about the care and removal of your stitches from your healthcare provider. After your discharge stops, many women discover that they have some degree of vaginal dryness, especially if they are breastfeeding. If so, you may need to use a water-based lubricant during sex. You will also find that your vagina feels looser. Some of this looseness will resolve in time. Doing your Kegel exercises will definitely help this process. For the first few weeks after giving birth, you may find that you are peeing a lot. This is your body's way to get rid of all the extra fluids that you were carrying around while you were pregnant. You may also have problems with urinary incontinence or not being able to hold your urine. This should also resolve with time, and Kegels will help with this too. If this is a problem during sexual activity, simply lay down a towel beneath you. Many women suffer from hemorrhoids after giving birth. Use over-the-counter products like Tux to soothe your anal area. If you had a C-section, you will have both external and internal stitches. These will need time to heal completely prior to returning to sexual activity. If you had any other complications during or after childbirth, please follow your healthcare provider's instructions about sexual activity. Mothers may feel many emotions following childbirth. Some of these are based on hormonal changes, some on lifestyle changes. Many women feel a honeymoon period during which they fall in love with their baby. You may feel an intense and overwhelming love for your newborn that seems stronger than anything else you have felt in your life. You may rightfully feel pride and satisfaction that you made it through pregnancy and that you brought this little being into the world. Other feelings are not so happy. It's completely normal to feel overwhelmed by the intensity of caring constantly for a new baby. There is a deep, deep fatigue that only new parents know from the lack of sleep. All of the physical changes we've discussed can have a strong impact on how you view your body. Yes, it was a great thing that you did, but you may not want to look in the mirror anymore. The change in your body image can really dampen a woman's desire to get naked and have sex. While it is very common for new mothers to feel the baby blues due to the rapidly changing hormone levels, some women feel a sadness that doesn't go away. If the baby blues don't go away on their own, you may be suffering from postpartum depression. Please talk to your healthcare provider or seek mental health care. Postnatal abstinence is the period after childbirth when you need to refrain from sexual intercourse. A woman's body needs time to heal after delivery. Always check with your provider to find out if your cervix is healed. Everyone is different, but the average wait is between 4 and 7 weeks. This time allows the woman's body to heal from any trauma or stitches from the episiotomy, a C-section operation, or any tears. It also allows time for the cervix to close. All these precautions help to avoid infections. Do not put anything at all into your vagina until the cervix is completely healed. This includes tampons and douches. It also means no penetration from your partner's penis, your fingers or his fingers, or sexual objects. In spite of these restrictions, orgasm is okay. Manual or oral stimulation is acceptable as long as nothing penetrates the vagina. Partners, you need to look out for the health of the new mom. It is very important because postpartum infections can be very serious. If severe enough, an infection can have lifelong impacts on a woman's health and reproductive abilities. Moms, the best way to boost your sex drive is to take care of yourself. Eat a healthy diet and drink plenty of water to replace your body's vitamins, minerals, and fluids. Most providers recommend a woman continue prenatal vitamins for at least 6 weeks or for the duration of breastfeeding. Check with your own provider to see if they want you to keep taking your prenatal vitamins. Sleep whenever you can. Sleep when the baby sleeps. Sleep when a family member or a neighbor comes over to offer to help out. Sleep, sleep, sleep. This is not the time to worry about how the house looks. Exercise. Start walking as soon as you get the okay from your provider. Walking together as a family can be a great bonding time and exercise for everyone. If you have never tried yoga or mindfulness exercises before, now would be a great way to start. Do your Kegel exercises every day. I have a handout on Kegels that I will pass around at the end of class. Ask for help and support if you need it, and most new mothers need it. Ladies, with all the changes your body has gone through during pregnancy and childbirth, it might be easier to have sex by yourself first. Explore what feels good and what doesn't, so that you can pass this knowledge on to your partner. Breastfeeding can have an impact on both a woman's sexuality and on contraception. There are 2 main hormones involved with breastfeeding, oxytocin and estrogen. Oxytocin is a hormone associated with both breastfeeding and sexuality. It creates feelings of contentment and satisfaction. Estrogen levels decrease while a woman is lactating or producing milk. This may cause vaginal dryness in some women. If this is an issue for you, use a water-based lubricant. Different women have different feelings when they breastfeed. Some women may feel more empowered and more in touch with their bodies. Other women may have feelings that their breasts belong to either their partner or the baby. Some women simply feel touched out by all the physical contact with the baby and don't want any more physical contact with anyone else. Partners may feel differently about their mother As a woman, some partners take pride in the mother's ability to feed their baby. Some partners find it enhances their partner's sexuality. Some partners may feel pushed out by the intensity of the mother-baby bond. Here are some practical tips for sexual activity and the breastfeeding family. Breasts may feel either extra tender or less sensitive depending on the woman. Let your partner know. Wear a night bra at night with breast pads during sex if leakage is a problem. Nurse or pump right before sex to empty your breast for your own comfort and to reduce leakage. If your partner wants to taste your breast milk, that's okay. Breastfeeding can be used as a form of contraception, but there are certain guidelines that must be followed for it to be effective. Although most emphasis is on the new mother, and rightfully so, dads have a lot of adjustments too. It's okay to talk about your feelings. In fact, it is important not to keep them bottled up inside. Dads can get depressed too after the baby is born. Some dads may feel jealous that the baby is taking the mother's time, energy, and love away from him. Some dads feel extra fatigued, as well as the mom. Everyone in the household gets sleep deprived when there is a newborn. Sleep whenever you can, just like mom. Learn to support each other. Take turns with the baby care, with nighttime care, or with household chores. Look at each other as teammates. You're both on the same side. Moms, let dad give baby a bath or take baby out for a walk. It's an important time for them to bond. Support your partner. Practice patience with each other. Share the work, leaving your partner more energy for sexual activity. Participate in childcare and household tasks as much as you can. Tell your partner how attractive she is without pressuring her to have sex. Communication about sex and sexuality can enhance your intimate relationship. It can bring you closer. It can help you get into the mood for sexual activity. It can also improve the quality of the sexual activity when you each know what the other one wants. For some people, talking about sex is easy and comfortable. For other couples, it may be more awkward at first. Here are a few hints on how to communicate effectively with your partner. Start from a place of love and mutual empathy. You care about each other. You just made this wonderful baby together. This can be a very happy time. Build from that place. Ask each other questions. It can be helpful to ask open-ended questions that allow a more in-depth answer. Rather than asking, "Was it good for you, baby?" Try asking something like, "What felt the best? Would you like me to do that more?" Listen actively. Turn off phones and all other electronics. Pay attention to the person talking. Look at them. Really listen not only to what they are saying, but how they are saying it. Check back with your partner to make sure you truly understand what they are trying to say. If you're not sure, ask for clarification. Provide honest feedback for each other and support each other. Here are a few tips for improving intimacy after childbirth. First off, orgasm is not everything. Look for alternate intimate acts other than intercourse. Aim for intimacy, not orgasm the first few times. If orgasm happens, great. If not, that's okay too. Try new things, new positions, new techniques, new activities, whether it's oral, manual, phone sex. Be creative. Try old things you used to do when you were a teenager or you were dating. Go back to holding hands, giving back rubs, petting, which is also called outer course instead of intercourse. Use perineal care as a partner activity. Have your partner oil and massage your perineal area and apply heat or cold if that feels good. If you're both too tired at night, try to set aside time for intimacy during the day if at all possible. If time is limited, sometimes shortening foreplay can help. As far as the baby or other siblings, some mothers are more relaxed if the sleeping baby is close by in the next room. Other mothers only relax if the baby is dropped off at the grandparents' or neighbor's house. Whatever works best for you and whatever helps you relax. The famous sex research team of Masters and Johnson developed a touching exercise to help couples overcome sexual obstacles. The object of this exercise is to touch each other without having it lead to sexual intercourse. The person who is doing the toucher, if you will, is using the touch to explore their own pleasure. This person will touch the partner's body in ways that make them feel good. Of course, the one being touched, the touchee, will always have control over being touched. If something hurts or is uncomfortable or you simply don't like it, then say so. The toucher can then move on to a different kind of touching or in a different place. The toucher can set the mood with candles, soft lights, music, pillows. This exercise is meant to be non-sexual, but can be intensely sensual. Explore your partner's body. Explore what you like about it and which parts you enjoy touching. Learn to communicate with your partner about what feels good and what doesn't. Take a 10-minute turn and then swap places. The toucher becomes the touchee. This exercise can help to eliminate any anxiety about sexual performance because there is no performance, only touching. Let's watch a brief video in which a sex therapist will explain more about how it works. When you feel ready for sex, pace yourself and start slow. Women, it is essential that you tell your partner if you are in pain. Sex should not hurt. Use lots of lubricant. Experiment with whichever brand works best for you. Work up to penetration. Outer course refers to sexual stimulation through one's clothes as opposed to intercourse. Partners, you need to follow the mother's lead, whatever she's comfortable with. For example, if mom is self-conscious about her body changes, try keeping the lights off. Also, try not to talk about the baby, or money problems, or job problems. Focus on each other. Be in the moment. There are ways to deal with minor discomforts. Try lots of pillows. Try ice or heat, either before or after sex. And if you think it might be uncomfortable, mom can try taking some over-the-counter pain relief like Tylenol or Motrin, as long as it's okay with her doctor. Some discomfort may be normal initially. However, if sex hurts, or if sex continues to be uncomfortable for the mother, seek professional medical help, like your midwife, your OBGYN, or a pelvic rehabilitation physical therapist. You may have had favorite positions before childbirth. However, now is a good time to experiment with new sexual positions. Each couple will need to discover what works best for them, being careful not to put any pressure on incision areas. After vaginal delivery, you want to avoid putting pressure on the perineal area. One of these seated positions might be helpful because the woman can control both the depth and the speed. Basically, whatever works for both of you and doesn't cause any pain or discomfort. After a C-section, there is less discomfort in the perineal area than a vaginal delivery. However, the woman's cervix still needs time to heal before penetration. Once you do return to sexual intercourse, you will still want to avoid putting pressure on her abdominal area, where her incisions were. One choice is a side-lying position, either face-to-face or spooning as shown in the illustration on the left. Another good option is a seated face-to-face position, like this seated position on the right. If you want to avoid getting pregnant again, be sure to use contraception the very first time you have intercourse and every time you have intercourse. You will want to consider several things when making the decision of what type of contraception to use. For example, what are your family planning goals? If you want to try to get pregnant again fairly soon, then a barrier method may be the best choice for you, since it is completely reversible. If you are convinced that you never want any more children, then you might want to consider either male or female sterilization. If you are somewhere between those two choices, and you eventually want to try to get pregnant again, but not right now, then a hormonal method or IUD might suit you well. Keep in mind that the CDC recommends waiting at least 21 days after you give birth before starting any hormonal method of contraception. Hormones can also impact milk supply for those women who are breastfeeding. Some forms of birth control should not be used depending on the age, ethnicity, or general health of the woman. Please consult your healthcare provider to discuss which method may be best for you. The only method of contraception that is 100% effective all the time is abstinence, or sexual activity that cannot lead to fertilization. However, since you're in a class about sexuality, let's look further. There are two main types of natural family planning. Fertility awareness method tracks a woman's ovulation and menstrual cycle to avoid having sex during her fertile time. Lactational amenorrhea method, lactational meaning breastfeeding, amenorrhea meaning not having any periods. This method relies on the hormones of breastfeeding that keep a woman's fertility in check up to the first 6 months. Either of these methods can be quite effective if certain guidelines are followed. I can give follow-up help to any couple who wishes to learn more about either of these methods. Contraceptives that rely on the use of hormones, including the birth control pill, implant, patch, shot, or ring, can be very effective. Barrier methods prevent the sperm from reaching the egg to fertilize it. These include the male condom, the female condom, the diaphragm, and the cervical cap. There are also a couple of IUDs available now. An IUD is an intrauterine device placed by a doctor into the mother's uterus. It prevents any fertilized eggs from implanting into the uterine wall. Some of these can stay in place up to 12 years. Sterilization should be considered permanent. Vasectomy is a very simple procedure for a man. Tubal ligation involves surgery for a woman and is more complicated. Having a baby puts stress on the family. Whether this is your first child or you have other children at home, dealing with stress can be difficult. It helps to have some strategies to help you cope. Here are a few suggestions. Try to keep your sense of humor. Stay patient with yourself, your partner, and your child. Accept that life as you know it will change. And try to go with the flow. Set your priorities together as a couple and as a family. If you are having money problems, or if the child or mother has any medical issues from the childbirth, this can put even more strain on the family. If you or your partner are getting angry more often, for whatever reason, please reach out for help. If relationship problems worsen, seek counseling. If sexuality problems persist, consult your healthcare provider. They can refer you to a specialist. Your first source of information about your personal situation should always be your healthcare provider. In addition, here are a list of resources that you can turn to for more information. I will have a handout with this information on it. I would like to remind you that not everything you read online is accurate or safe. Please be careful when you're researching things online and take some things with a grain of salt. Or refer back to your doctor and ask for clarification. I hope that this presentation has been informative. It is impossible to include everything you might need to know for your personal situation. So if you have other questions, please let me know or talk to your healthcare provider. Let's take a minute to see if we have addressed all the issues you had at the beginning of class by going over what we have on the board in front of us. Now I have some time left over. Please feel free to ask any other questions that you might have. Thank you so much for your time and attention. If I can help you in the future, please take one of my business cards on the table and feel free to pick up any of the printed materials that are available. I'm always looking for ways to improve this class. I will hand you a short survey. Your answers will be anonymous. It would be very helpful if you could answer these questions honestly. Thank you again, and good luck.